Welcome to Nest Builders, our parent education expert talks, where we share trusted guidance and expert insights to help build a strong foundation for a happy, healthy family. I'm Brittany Madonna, Senior Vice President of Marketing and Communications here at the Nest Schools, and we're diving into a milestone every parent encounters today, potty training. To help us navigate this important stage, I'm joined by Dr. Hellstern and Dr. Quattrone from Zest Pediatrics Network, the Nest School's official medical education partner. They'll be sharing their expertise and practical strategies to help make potty training a smoother experience for both you and your child. But before we get started today, doctors, if you could please share a little bit about yourselves and Zest Pediatric Network.
Hi, I'm Dr. Hayley Hellstern, and Dr. Quattrone and I are based in Pittsburgh, and we are pediatricians who are part of the Zest Pediatric Network, which is in Pittsburgh and also Cleveland, Ohio. And Zest Pediatrics, if you don't know, is basically a group of pediatricians who have joined together to provide care for kids. And we are a direct primary care style of office, meaning we provide 24/7 communication. We are the only doctor who sees your child, and we are able to do that and take such excellent care of your kiddos because we actually don't go through insurance companies. So our families have a monthly membership, and they get all sorts of awesome access to their specific Zest pediatrician. And then we do lots of different webinars and seminars and classes and talks and things like that too. Dr. Quattrone, do you have anything to add about Zest?
Just that, we're really excited to be able to provide direct care to our patients. We do really think it's a better way to provide care. We have small patient panels, so we really get to know our families. They can text us, call us, email us. It comes directly to us. And, office visits are unlimited, so we don't have to stick to any specific schedule. So we really do believe that by building that relationship, we can provide better care for the children.
Well, thank you all so much for introducing us to Zest Pediatrics. And let's just go ahead and get the conversation about today's topic around potty training. So I think the first question that most parents are asking or want to know is, when do you all feel the best time is to begin potty training?
Yeah, that's a really great question. And I agree. I think Dr. Quattrone and I hear that question all the time. And parents often will start asking when their kid is between 1 and 2. And that's really when we first start thinking about potty training too. I think in general, between 18 to 20 months and maybe 3 years or so is when a lot of families find that potty training starts to work. That's when kids start being, in general, old enough and big enough to hold their pee for a little bit longer, and are more physically able to do things. But it really is going to depend on family and like what's going on in your family, and also your own child's development. So I think it's very child specific. And, if one sibling potty trained at 2, the other one might not potty train until 3 or vice versa. So there are a lot of specific developmental milestones that we look for when we are kind of assessing for signs of readiness for a particular child to start the potty training process.
Perfect. And are there any, as far as, how do you know when your child is ready? What are the telltale signs that they should be looking for?
Absolutely. So, number one would be if they are showing interest. So yeah, you're going to let them come, watch you go use the potty so they know what happens in there. So when they start to throw interest, even if it's something as simple as like, let me throw some toys in the toilet, we're getting interest in the potty. And so that's the first step there. You want to be able to hold your urine for at least 2 hours at a time. As Hayley kind of mentioned, the bladder starts to have that capacity to hold urine for longer, and kids don't need to go as frequently. They should be able to follow directions, so to understand the process of using the potty. And then a big thing is, when they start to show that they don't like the feeling of a wet diaper or, bowel movement in their diaper. And along that line, they should not have any constipation for at least 2 weeks, because if they're constipated, having trouble pooping, that's going to backfire when we try to go and use the potty.
Yeah. Dr. Quattrone, another thing that I find a lot is that it helps if kids, and you probably see this too, but it helps when kids are able to communicate in some way or another, right? So like looking for those communication milestones of being able to indicate to you as a parent or a caregiver, yes, I am, my diaper is dirty, or yes, I need to use the bathroom, like whether it's through sign language or tapping and tugging on you or using words. And then also having just some of the like dexterity and gross motor skills to be able to remove their clothes in order to go to the bathroom. So I found with my kids, a lot of the times they started showing signs of readiness by just stripping down naked. And that was excellent for us too, because eventually a parent or caregiver is not going to be there every single time the child needs to use the restroom.
Right. No, those are all excellent points. Well, so we've talked a little bit about how to know when your child is ready, the signs to look for. So now that you've decided that your child is ready to take that step and you want to begin the potty training process, how do you actually start that with your child?
Absolutely. I think the big thing is coming up with a firm time that you're going to start and not being wishy-washy about it. So you're either all in or you're not. I think a lot of times parents just kind of put a little potty around the house to see if their kid's going to do it, but that just kind of teaches them that it's a toy. And so I think coming up with a day and saying, today is a big day. You're going to be a big kid, a big boy, a big girl. And today we're going to start putting your pee or putting your poop in the potty. And I'm going to teach you how, and we're going to work on this together. And so, coming up with like this plan, not asking a question, are you ready today? But saying today is the day and we're going to start learning how to do this. Some families find that having their kids throw away their diapers or, put them outside at least, and you can always keep them just in case, but, getting rid of them, kind of similar to how we like try to get rid of bottles or get rid of pacifiers, things like that, can be helpful. Another thing is, especially in the first couple of days, I think Dr. Quattrone and I both tend to follow more of like an all or nothing comprehensive, spend like 3 days or so with your kid essentially naked, and you are on them like white on rice, and they are naked, they're drinking a lot of water, and they're basically peeing everywhere. And then we're starting to show them, oh, I see pee on the floor. Let's put it in the potty. Let's, pick up your kid, put them on the potty. Let's see if we can get any pee in the potty, and turn it into a little bit of a game. Thank them for being so helpful. Like, thank you so much for getting your pee in the potty. That's exactly where it goes. That's great. And then I alluded to this a little bit before, but I think using commands a little bit, or suggestions rather than questions. Not, do you have to go or do you want to go? I mean, the answer is probably going to be no, right? Like, I want to watch a show or I want to play this game, but like, hey, come, it's time to pee. Or, oh, the timer's going off. Let's see if there's any pee in your body. Let's see if we can get some pee in the potty, and turn it into a little bit of a game and just kind of a curiosity, exploring some curiosity. Let's see if there's any poop in your body. Let's see if we can get that poop in the potty. And I think that could be helpful as well. And then in those first few days, especially, noticing those cues. I mean, we as parents, I think we all struggle with screen time, but putting our phones away, putting TV away, putting books away, we are watching our child and discovering what their potty cues are. Oh, I see that you're holding yourself. Oh, I see that you're doing a potty dance. It looks like your body might have some pee that needs to go into the potty. Let's sit on the potty and see if something's ready to come out. I see that it looks like you have to poop. A lot of kids will start hiding under the dinner table or in a corner when they have to poop. Oh, I see that it looks like your body is getting ready to make a poop. Let's sit on the potty so the poop ends up in the potty. And I think those are really key. Dr. Quattrone, do you want to talk a little bit about kind of like the timing of all of this and how long it usually takes and that sort of stuff, or any other suggestions that you have?
Yeah, definitely. So my favorite book is the Potty Training 3 Days by Brandy Brooks, who is actually, believe it or not, a professional potty trainer. And who knew that was a job? But it sounds like she does it, and she does it well. And she shares all of her wealth of knowledge in this book. But generally, she suggests to try to really dedicate 3 days. If it's not working, dedicate up to 10 before you give up on the process. And so, some things we need to think about, don't stress, right? Because your child's going to pick up on those feelings, that anxiety. If you're excited, you let them know it will be fun, then they'll pick up on that and kind of go along with your attitude about it. Always stick to the plan. Don't get in it and then, decide, oh, we're just going to, give you back your diapers. We'll try again another time. If you're dedicating that time, you pick those 3 days, that weekend that you're just going to dedicate to potty training, stick with it. As Dr. Hayley alluded to, potty chairs in every room of the house lets them know, again, this is a toy, or, hey, we can pee and poop anywhere, really. So we want to really focus on only going potty in the bathroom. Don't wait for your child to tell you they're ready, right? We have to ask them. And then, some parents want to have their child sit on the potty every 30 minutes. This will kind of backfire. They need to know the feeling of a full bladder. I don't pee every 30 minutes. Most kids don't. So really giving them that time and then recognizing when they need to go, and try not to get frustrated when they have an accident. Because that just also backfires and hinders the process. So in these 3 days, really, like Dr. Hayley said, you don't want to take your eyes off of them, right? So don't be on your phone for more than like 15, 30 seconds. And on the flip side, also, you don't want them to get zoned out on the TV or the tablet because, you don't recognize what's going on with your body as much.
Don't want pee on the couch.
Exactly. Yeah. And while you can put on a pull-up at night, because some kids, they do take longer to have that bladder capacity to hold urine overnight, you do not want to give back a diaper or a pull-up during the day. And then, we'll talk a little bit more about equipment and how we do the process, but, rewards are a big thing. So you always want to make sure you only reward them when they're truly successful at using the potty. Keep that reward, that jar of treats somewhere where they can see it in the bathroom in a clear jar. So they know that if they do a great job, they're going to get an M&M or some kind of reward for it.
Yeah. And it's so interesting, Dr. Marisa, like, there are several different books out there, and I think a lot of the ones that we follow are fairly similar. We used the book called Oh Crap, Potty Training. Very, very similar. A couple like different nuances. I mean, I'll admit we had a potty in each room of the house in the beginning because that just worked better for us because the bathroom was like all the way down the hall. And I was like, there's no way my child actively peeing is going to make it, or else I'm going to have a trail of pee or worse in our house. But, very, very similarly, right? Like the first couple of days, especially the very first day, like, honestly, I didn't expect much pee to get in the potty, right? It's more like the kiddo was recognizing that they're peeing, like, oh, pee's actually coming out of my body and landing on the floor. Because if you think about it, like they've just had a diaper kind of holding it in place for their entire lives. And so just learning what that even feels like not having a diaper around. And slowly kind of working their way towards starting, oh, I am peeing. Oh, now I know that I'm about to pee or I have to pee, and really acting on that. And then after the first couple of days, once they've gotten that down and we're having fewer and fewer instances of getting the pee on the floor and instead it's getting in the potty, then we can start putting some clothes back on. At least in the book that I followed and the method that I followed, we basically kept the kiddos without any undies on for quite some time because underwear often kind of cradles their diaper area and mimics a bit the sensation of having a diaper. And so I think sometimes kids can think that they have a diaper on or think that their underwear is going to catch the pee or catch the poop like their diaper used to. And so we kind of kept our kiddos commando for a good week or two afterwards, or just like a long t-shirt or something like that for a while, and then gradually introduced underwear again and longer trips again. And we often found one of my kiddos, we ended up doing it over like winter break. Like she just decided, I think it was Christmas morning, like she just kept taking off her diaper. And I was like, you know what, maybe now is the time. And my husband and I both had a week that we had taken off. And so it was great. Like we had at least those 3 days plus a little bit extra to dedicate towards that time.
Great. Well, I think you mentioned two really, really important things. One, making sure that you find a time frame that you can really commit to it, which I think can be difficult, but makes an impact. And then I think I know I did this as when my kids were going through potty training, but asking them. I really, really liked your point about making it more of a command versus asking them if they have to, because I think at that age, telling children probably goes over a lot better in the process.
It's kind of like with food, right? Oh, do you want the broccoli? Like, oh, we're having broccoli, actually.
Yeah. Great. Wonderful. Well, anything else on as far as knowing when your child is ready, or should we move on to, how long that we really feel like this process should take overall?
I think I was thinking of like one or two other things, like from the Oh Crap potty training book. I think I really like some of these books because they give us some verbiage and some ideas of as parents how to approach things, like what we talked about, giving potty commands rather than questions. Another one that stuck out with my husband and myself was, instead of talking about pulling down the pants, talking about pushing down the pants, which for kids, it's really a pushing motion. And I think, they can sometimes get confused with pulling down their pants, like pulling from where. Just really thinking about being deliberate in the words that we're using can be really helpful. And then I think talking about the timing, another thing is to, not just make sure that you have the time to dedicate, but just recognize that for most parents, when we're going through this and working on toilet training with our children, try not to have a bunch of parties planned or, running out to the store and things like that. That's, that will come. But for the first couple of days, I think it's easiest, as much as you can, to be at home in a controlled environment with the bathroom or toilet close by, and just have that be your main focus.
Right.
It's not like a secondary thing in the background. It's like, it's your main thing.
Yes. And I know, generally speaking, you always start out working through the day. When do you start making that transition into nighttime?
I would say whenever you realize they're waking up dry in the morning, that's when they've developed the capacity for their bladder to hold urine all night.
Okay.
Yeah, I think it depends for each kiddo. With my kiddos, after about the first week or so, we also abandoned the diapers or pull-ups at night just to see what happened. And with both of my kiddos, within a month or two, they were waking up dry. And so honestly, like, some of my little tips and tricks is I would always keep, we got the waterproof mattress covers, and we would have a couple of them. So in the middle of the night, if everything got wet, we would just quick strip the bed, put it in the laundry, replace the mattress cover, replace the sheets, and start afresh. Another thing, similarly with like the asking or telling, not asking, part of our bedtime routine became emptying our bladder before bed. So again, not a question of do you have to pee before bed, but let's see if your body has any pee to get rid of before bed. And then I think another thing to keep in mind, like what Dr. Marisa was saying, is every child is different. And some kiddos, and this can be normal, some kiddos aren't going to be able to withhold their pee, or their bodies won't be able to kind of concentrate their urine and not make large volumes until they're in grade school, like 8, 9, 10, 11, even 12. By college, most kids are able to.
Let's hope.
But if it's not happening and your kiddo is like waking up soaking wet every single night, then just give it more time, and that is okay. And then, create some boundaries around it. Like, oh, the pull-up only goes on when the sun is set, or something like that. And then once it is light outside, we take it off, because in the daytime we put our pee in the potty, something like that. But I never recommend like reprimanding children for being wet in the middle of the night. It's really a physiological, like a body process. Like, their brains and their kidneys need to be mature enough, and a child has no control over that ability.
Great. Okay, so we've talked a lot about starting the potty training process at home. You're successful at home. You've taken the time off. Now you have to go back to work, or your child is going back to their preschool program. How do you ensure that you have a smooth transition and keep all the progress that you've made intact?
That is huge. It's a huge question. And it can be really challenging and really nerve-wracking for a lot of families. I think the biggest thing is consistency. Just like you had consistency at home, trying to keep the same momentum going with whatever caregiver or daycare program your child is with. So I think having a conversation with your child's preschool teachers or their caregivers about this is the method that we're doing. This is how we've been approaching it at home, whether you're doing any reward system or not, how often you're putting them on the potty or not. And then requesting, asking, having an open conversation with your child's, daytime caregiver, to the best of your ability, how can you go about kind of mimicking this schedule or keeping them on this same momentum? And sometimes it's not exactly possible to do the exact same thing that you were doing at home, but trying in general to all be on the same page of this really worked for little Tina, or this did not work for her, so we're kind of doing it this way instead, and just trying to keep the same consistency during the day will hopefully prevent a lot of setbacks. And sometimes parents will come to me saying like, yeah, then my kiddo went off to, wherever, and they did it completely differently. And then it's like a disaster at home, but they never actually told the preschool teachers what they were doing. And so I think having that conversation is really important to see as much as possible how you can maintain that consistency.
Yeah, great advice and great tips. And I do think one of the benefits too is a lot of times children that are in that potty training stage tend to be around other children that are doing it. So they're kind of watching, other kids and knowing, and it's kind of, the teachers, I'll have to admit, I think that in my case, a lot of times I look to the school to tell me that my child was ready to start. And then I kind of started making those plans at home too. So open communication is, I agree, it's very important to make sure it works on both sides.
Communication is always the answer, isn't it?
Yes, so true. Well, now I think, on the flip side, there are some times I'm sure that are not ideal for potty training. We've kind of talked about all the ways to know when to start and how to start. But are there any times that you would recommend that are not ideal times to consider potty training for your child?
So I would say, you really have to have that time to focus and dedicate. So, an ideal time would be when you could be at home for those at least 3 days to really focus on it. If, you have a big trip coming up, or mom's pregnant and due very soon, that could be a setback if you start potty training right before a new sibling arrives. If again, if the child is constipated, that can really hinder progress with potty training as well.
Mm-hmm. Absolutely. Yeah, I think constipation is a huge one too, Dr. Marisa, right? Like, and talking with your pediatrician, like we're able to help with these sorts of things. We can recommend little modifications to your child's diet, or even some very, basic and safe medications to help. I mean, because the goal, without getting too graphic, right, is that your child is able to pass like a soft stool each day, and they shouldn't have to work hard. And with constipation, a couple things can happen. One is it can get in the way of your child's ability to pee, and then can lead to urinary tract infections. But the other thing that constipation can do is then if it hurts to poop, then your child's going to be developing a negative association with pooping, whether it be in the diaper or on the potty. And then they're going to start doing these withholding behaviors. And that leads to its whole other behavioral kind of, train off the track situation. And so really making sure that your child is peeing and pooping on a regular and comfortable basis is a huge thing. But yeah, like what Dr. Marisa was saying, any big changes, right? Moving a house, starting a brand new school, having a new baby at home, going on a big trip, whether it be driving or flying, right? Like ideally, right? Realistically, we don't want to be trying to potty train a toddler while they're on a flight, right?
Right.
Trying to avoid
Nobody wants to use the airplane bathroom.
that would be so hard, especially during takeoff. I have to pee, like, hold it. I don't know.
So avoid any time when there is major change going on in your child's life. Yes, that is super important to keep in mind. And then I think the other big question that I think, especially even since, when my children were potty training 10 plus years ago, there are a lot of new cool things out there to assist with potty training. Is there any particular equipment that you all like that you would recommend that you have seen be successful to help with this important stage?
Absolutely. I'm a simple person. I know there's a lot of, like you said, a lot of things, a lot of bells and whistles out there, but I'm really simple, just back to the basics. So when you're getting ready to potty train, things you want to have. So decide on a reward. And if it's candy, it's candy, right? If it's you don't want it to be like a car, because let's say they do go potty 5 times in a week, 5 times a day. That's 35 cars, right? So that's too many cars. But just like a small treat, something that will really motivate them. Keep it in a clear jar where they can visualize it. You want to have a sticker chart and some stickers, right? Some kids are really motivated by that. That way, it's kind of like a double reward. You go on the potty, you get your treat, you get to put a sticker on the chart. You want to have overnight pull-ups that are different from what they currently wear. Again, we don't want that similarity. We don't want to fall back in our old ways. A short shirt and maybe 2 or 3 packs of new underwear that they can be excited about for when you're ready for underwear. A stepping stool for the toilet is very important, just so they can get up there and feel comfortable up there. And then a toilet trainer, which is a seat that goes on top of the toilet, is really key too. So just something plain. The Baby Bjorn is Brandy's favorite that she writes about in her book. That's the one I have on all my toilets here. It's great. It fits most toilets. It locks in. It's comfortable. And then you want to have fluids around so that they have plenty to drink while you're stuck at home, focusing on potty training, and maybe some indoor activities, some puzzles, some games, something new to keep their attention while you guys are really trying to just stay home and focus on what's going on and being in tune with their body.
Yeah. A couple gadgets that worked for us. Again, I mentioned we ended up having a potty in each room because of the weird layout of our house. So we got like the little Baby Bjorn potties for our room and then transitioned to using the regular toilet in our house. They make I think Dr. Marisa, what you were talking about is like the Baby Bjorn one that kind of sits on top of your toilet.
Mhm.
Is great. So they make several like that. Another one that we discovered at actually a friend's house is they make toilet seats that you can buy. It's by a company called Top Seat, and it's literally a new toilet lid that you can put on that has a regular adult size one, and then within it has a little kid one that you can flip down, so it looks just like the regular adult seat but flips down. It's like $30 on Amazon, and that's what we use now with our toddler. And then I think also having something for travel. So we often brought our tiny little Baby Bjorn potty with us in the trunk of our car on every road trip, especially in the beginning, even the small ones to the grocery store, just so our child had a place to pee or poop. But it really came in handy, on the highways and things like that with our big trips
I
to have.
still have that in my car. She's 6.
We still have ours. And there's no shame if, as an adult, you need to use it too.
I've used it when we were hiking. I did once.
They also, if you don't want to be bringing an entire toilet in your car, they make, I think Boone or one of those make like a fold up potty that you can like bring with you in your diaper bag or purse and put on a toilet. And then a really low cost, easy trick that I learned because a lot of kids, especially like one of my kids has some kind of sensory sensitivities, and the automatic flushers terrified him. You can take a Post-it note and stick it on the sensor so that the toilet doesn't like keep going off while they're trying to use the bathroom.
That's very smart.
And that's really helpful. And then I realized we completely forgot to talk about this, but for those of us with boys, right, it's a little bit different because there's all of like the standing up process in the beginning. I think having them sit down for peeing and pooping is the way to go. But, if you're a woman watching this, we don't have the same anatomy. Just have them push their penis downward or else you're going to get pee everywhere. So just going to put that out there, have them point it downward. And then usually after a couple of years, boys will start asking about using urinals or standing up to pee. And that's fine, but it does take them a while. Ask me how I know.
But it does get them comfortable actually learning how to sit on the body.
Exactly. And so I just recommend having boys and girls alike sit. And then I think something else that we didn't touch on, but I think is really important, is using I think it's really important to use the right terms for our body parts. And I think that's a safety thing too, not calling it a cookie, right? Or calling it a hot dog or something like that. But, like, this is your penis. And that way we know like exactly what you're talking about. If something is hurting, if something is bothering you, like there's no question what we're talking about. And so penis, vulva, or vagina, like having the right anatomical terms, I think is really important for potty training. And then also for safety, so that if anything happens, your child is able to actually tell you what's going on.
Very important. Good advice. Is there anything else that we want to touch on? It's been a great conversation so far. Anything else that we left off that we want to make sure parents know? Any other resources that we want to talk about?
I think getting some sort of book or preparing yourself in some way is really important. You don't want to be ideally learning it as you go. I mean, we all modify and switch plans a little bit, but I think, you having a unified plan is really important. If it's you and your partner at home, having both of you be on the same page. If it's you, your partner, and then you have a grandparent or something watching your kids, have everybody read the same book, or at least be in agreement with what the process is going to be. Or else you're going to have like a toddler who pees one way with grandma, one way with grandpa, one way with dad, one way with mom, right? And that's not going to work really well. So everybody should be on the same page. I think that's really helpful.
I could not more agree with that. I think that can be the most challenging part, especially if they spend time at grandparents' houses or in other places, just making sure that everybody's on the same page. That's great advice.
That's how it is with everything, right? Like we all know how it is with, grandma's rules, and then the kids come home and you're like, oh, we just undid like
yes.
work. I love grandparents. I do. But it is a struggle, and I see it a lot with potty training. And then also, I'm sure, Dr. Marisa, you agree, lean on your pediatrician, right? Like we deal with this, talk about this day in and day out. We see all sorts of kids with constipation, with like vulvovaginitis. A lot of times little girls will get irritation in their vulvar areas from wiping too aggressively or not wiping enough. We see this all the time. So if there's anything that doesn't seem like it's going right, or your child's complaining that something's hurting or bothering them or itching, talk to us about it. Maybe come see us. We're here to help.
Great. Well, thank you all so much. I always enjoy our conversation with you all. You had such wonderful advice to share with our parents to help them be successful in potty training and in all facets of growing up. So thank you all so much for joining us today. And if you are interested in learning more about Zest Pediatrics, check out their website at www.zestpeds.com. And then also make sure to check out more of our Nest Builders topics. We have a variety of episodes covering all stages of life to help families be successful. And you can find those episodes on our website, thenestschool.com, or on our YouTube channel. Thank you again for joining us, and we look forward to seeing you next time.
Thank you.
Thank you.